Good afternoon, everyone. We'll get started momentarily. I do realize that the Government of Ontario has just proceeded with the broadcast through the SMS network. So we'll give that a second to play out and then we'll get started here. Okay. Having heard the alerts go off on my end, I think we will now jump into the proceedings. My name is Scott Butler. I'm the Manager of Policy and Research for the Ontario Good Roads Association. It's my pleasure to welcome you to this webinar, the fourth and final webinar that we've run on this topic, looking at COVID-19 and its impacts on municipal highway maintenance and legal liability. We are extremely grateful to our corporate partners, Patterson McDougall LLP and the Frank Cowan Company, for their involvement and participation in this. We are joined today by Charles, pardon me, trouble time to get choked up. We're joined today by Charles Painter, partner at Patterson McDougall LLP and widely regarded as one of the preeminent experts in Ontario and one of the preeminent legal minds when it comes to municipal liability and specifically the minimum maintenance standard. Also joining us is Brian Anderson, road specialist with the Frank Cowan Company. Frank Cowan is one of the, and we're getting the second cohort here. Frank Cowan is one of the largest municipal insurers and a familiar company to, I assume, most people on the webinar today. And Brian previously, he's had decades of experience on the front lines in terms of providing roads transportation services, and previously was a manager of member services with the Ontario Good Roads Association. In terms of the agenda, it's going to be fairly straightforward. I will run through some quick overviews of sort of where we're at in Ontario in terms of the government's response, and turn the floor over then to Charles and Brian to run through their presentations. You will notice on your machine that the GoToWebinar module has popped up. In there, there's a chat platform and there are questions. If at any point you have questions that you would like to pose to our panelists, please enter them there. Either of those forums would work. We'll be monitoring both and I will work to present them. And we should have time for a bit of Q&A at the end. So without any further ado, I'm going to jump into the presentation here. The current status, as of this morning, 41,000 people have been tested for COVID-19 in Ontario. Almost 1,000 have confirmed positive. There have been 18 deaths as a result of this. And these numbers are growing day over day. But unlike other jurisdictions, we're not seeing the massive spike that has been associated with this disease elsewhere. But I think everyone can anticipate this continuing to grow. The Government of Ontario has undertaken a number of different initiatives to respond to the COVID crisis. They have begun monitoring hospitals for potential cases. They've added 72 facilities outside of hospitals for testing. A number of legislative amendments were made to the public health legislation governing the response to pandemics, and the 2019 novel coronavirus was a designated disease under that legislation. This in turn allowed the command table, which is a committee of senior bureaucrats across the provincial government, to coordinate the response with an eye to doing a number of different things. Enhancing screening and access to screening, maximizing lab testing capacity, and implementing initiatives that keep people on the front lines and the public safe. On Wednesday, the Ontario government tabled a mini budget called the Ontario Action Plan. It had two initiatives within it that directly tied to the municipal sector. $148 million was earmarked for charitable and nonprofit organizations. These are things such as food banks, homeless shelters, churches, other NGOs engaged in emergency services, to provide them with capital that they would need in order to provide services and programs to respond to the COVID-19 crisis. This will be thrown through the Consolidated Municipal Services Managers or District Social Service Administration boards. The other initiative that was top of mind for municipalities is the province undertook the decision to defer $1.8 billion in upcoming property tax remittances that would go to fund education. These will be deferred, I believe, over 90 days. Within OGRA, we've undertaken the following. We've had our staff working remotely since March 13th, so that's 2 weeks ago today. All of our educational and professional development offerings have been rescheduled, and we're working to provide those at a later date in the fall. So for those of you on the line and having staff looking to be involved in those training initiatives, stay tuned. Further details will be forthcoming. We've also engaged our membership. As I said, this is the 4th seminar we've done looking at this particular issue. And in particular, what we're trying to do as an association is make sure we're capturing and responding to issues affecting municipal transportation and infrastructure services. So with that in mind, what I'm going to do now is turn over the presentation to Charles Painter. Charles, the floor is yours.
Thank you, Scott. Good afternoon, everyone. Happy Friday on this nice sunny afternoon. I'm going to try and go through my bit of the presentation as quickly as possible to leave time for Mr. Anderson to cover his topic. So without any further ado, let's begin. Scott, if we could jump to the 3rd slide here. In preparing for my presentation on the course of these webinars, I found a document from the United States Department of Homeland Security that describes stages of a pandemic, and it's part of a larger guide for preparedness, response, and recovery for critical infrastructure and key resources. It's available online. What we see here is that on the right-hand column, which has 0 to 6 in colors, that's the American Department of Homeland Security ranking for the stage of a pandemic. And on the left side is the World Health Organization's definitions and stages. And the two are somewhat similar but different. The interesting thing about this is, apart from the fact that when you read this guide, it's apparent that for many years, national governments have viewed our situation as being in between expected periods of pandemic. It's very clear that it's never been a question of if, it's always been a question of when and how bad a pandemic is going to be. And based on a couple of 100 years of experience and more, going back to times of plague in England even, this has been the case in civilized society. And what we see here is we're well into the pandemic period phase. Stage 5 is what the U.S. considers their current situation, where it's widespread human-to-human spreading of a particular virus or contagion. And then there's stage 6 coming up afterwards, which is the recovery phase from the initial pandemic and preparation for subsequent waves of influenza or similar virus like we have with COVID-19. So the point of this is that there's been a lot of planning and thinking, but we're still in a very interesting crisis for a number of reasons. Let's go to the next slide and we'll talk about that. So after SARS in 2005, the province of New Brunswick published a pandemic influenza planning guide for municipalities, and they talked in the document about how every year between 500 and 1,500 Canadians die from influenza and its complications, and that between 1 in every 4 or 1 in 10 is infected each season, and that alone causes significant impacts on health and productivity. It then recognizes that 3 times in the last 100 years there had been a worldwide or a pandemic of influenza that caused high rates of death and illness, and that's exactly what we find ourselves dealing with right now. and it cites the 1918 Spanish flu pandemic that caused over 20 million deaths around the world. Interestingly, this document in the immediate post-SARS era says that the next pandemic was expected to cause high rates of death and illness, resulting in a tremendous amount of social disruption. That's exactly what we have now. And they go on to say, assuming an illness rate of 35%, it would be estimated over 120,000 New Brunswickers would seek medical care during a pandemic. With an attack rate of 35%, that would mean that 1/3 of municipal staff may be out at any given time, and that some might die or some would die. And just that would cause an enormous strain on both health services and create human resource gaps in essential services for all communities. Well, I think everyone listening would agree we're in a situation where more than 1/3 of municipal staff are out. Many, if not most, have been sent to work from home. Some are quarantined or self-isolating due to illness or family members or friends that they've come into contact with. And that this has definitely caused a very significant human resource problem and crisis. Let's go to the next slide. So the town of Kapuskasing in 2009 published its pandemic influenza plan that talks about the following. It was recognized that a pandemic would affect the province and the rest of the country, and it was believed that a worst case prediction would be used. And so their worst case prediction is as follows, as you'll see under the heading 2.3.2. They planned and assumed that there'd be little or no assistance from the federal or provincial government apart from supplying vaccines and antivirals. The town would have to respond to an influenza pandemic on its own, and that an attack rate of 35% would be assumed. When planning, meaning about 35% of the population will have the flu severely enough to take 3 days off of work. Well, once again, we have a much different situation that far exceeds this worst case scenario planning back in 2009 when people were trying to prepare themselves for the next pandemic that unfortunately we are living through at the moment. The reason I'm going through this is because the concept of legal liability during a pandemic is something I've been thinking about quite a bit during these last few weeks. And it's going to be a situation where any judge in any courtroom, if someone sues one of your municipalities for some sort of accident, either in a park or a playground or on a street, the judge is going to have to remember that this situation is beyond what anybody imagined as a worst case scenario. So even though there would probably be an expectation that there had to have been some level of planning and preparation for a pandemic, given that there's tons of literature out there readily available predicting that there would be one. The question was just when, and we've now found out when, sadly. But it's far beyond what anybody really had thought would happen. So let's go to the next slide, please, Scott. And what we have in the next slide is a quote from a case from the 1800s. So this is even before the Spanish flu, which talks about an act of God. And the court said in this particular Canadian case from 1878 that a phenomenon need not be unique to amount to an act of God. It is sufficient if it was extraordinary, and it could not have been expected. I think both of those criteria are met here. It is an extraordinary situation of pandemic that we find ourselves in, given the unexpectedly nasty nature of this particular virus. Nasty in the sense that it spreads at such an incredibly high speed and a high rate. One person who gets infected tends to infect at least 4 other people, if not more. And it has some very unexpected health impacts, perhaps not as high a mortality rate as SARS or MERS, but because you have so many people infected in the aggregate, the amount of deaths far outweigh a more serious infection like MERS or SARS, where the death percentages of the limited amounts of people were so higher statistically. And it's just math. It's a simple question of if you get 1 million people infected, a certain percentage are bound to die. With SARS and MERS, it was so rapid in terms of its onset. People were sick before they had a chance to travel around and spread it for 2 weeks, like they seem to be able to with this coronavirus. Let's go to the next slide, please. So the City of Toronto reviewed its pandemic planning back in 2007, and the Auditor General identified 3 vital responsibilities of the city during a pandemic emergency: public health, continuity of operations, and employee health and support. The first one's pretty simple and straightforward: protecting human health by controlling the spread of the disease. That's what we're all doing, working from home these days. The continuity of operations is also fairly straightforward. You've got to maintain your critical city services, including policing, public transportation, ambulance, garbage, and drinking water treatment. So those are some of the more critical services, but you've also got an obligation to your employees to support them and to assist them through a pandemic and do what you can to better ensure their health and safety. And that's a big issue in many municipalities. So let's go to the next slide. So before I talk about the minimum maintenance standards, I want to make it clear that I'm not recommending that municipalities close their roads because of the pandemic. Keeping your roads open, keeping your sidewalks open, maintaining safety is very important for all municipalities during this pandemic. But there is going to be, if we continue along a certain trajectory, and we're not particularly lucky, some tough choices to be made in terms of allocating your limited resources. Now, one of the ways that could be done is a temporary or partial closure of a highway or sidewalk. And so while the MMS do not provide for any sort of automatic protection during a pandemic per se, it's not like the significant weather event declaration you can make when there's a forecast for a bad storm that meets the Government of Canada's weather hazard criteria. But what you can do under 16.8 is the following. You'll see the section says when a municipality closes a highway or part of a highway pursuant to its powers under the Act, which is the Municipal Act, the highway is deemed to be in a state of repair in respect of all conditions described in the regulation from the time of closure until it's reopened. And then it says, for the purposes of the foregoing section 1, a highway or part of a highway is closed on the earlier of A, when a municipality passes a bylaw to close the highway or part of the highway, and B, when a municipality has taken such steps as it determines necessary to temporarily close the highway or part of the highway. So what we can immediately see here is this section contemplates not having to pass a formal bylaw, at least to temporarily close a highway or part of a highway. When I was on the task force that drafted this statutory language, we were thinking about situations where you have a crisis more in the nature of a flood or something that isn't a significant weather event, maybe a bad accident, a fuel spill, something that, power lines go down and you've got to temporarily close a roadway just by parking a truck or putting up some traffic barrels, maybe in conjunction with the police. And so we're thinking about, if somebody ignores that type of warning, goes or skirts around the barricade and uses the road, which may be icy or dangerous, and gets injured because of the roadway, it would be terribly unfair for them to be able to sue you for the things that are covered under the MMS. So that was the original thought. But this also could apply to the current situation because it doesn't limit it to anything at all. It's simply when a municipality takes the steps it determines necessary to temporarily close a highway or part of a highway, it's deemed in repair for the MMS items that are covered. So some creativity may come into play, and it may be in conjunction with an emergency declaration under the Emergency Management and Civil Protection Act. So why don't we skip to the next slide, please? So before we talk about that act, Just a reminder that there's broad municipal powers to control things within their jurisdiction, and highways and transportation systems under Section 11 of the Municipal Act are clearly, if they're lower tier highways, if you own them, then you can pass your bylaws and you can control them. So let's go to the next slide. The MMS are not mandatory. That's the other thing. A lot of people are saying, well, if we're short-staffed and we're not meeting the MMS, are we going to be liable if we're sued? The answer is not necessarily at all. And in fact, I think a judge would understand. But another answer, a legal answer, is you're not deprived of a defense. If you look at Section 44 of the Municipal Act, Section 3, these are the defenses. The first one is sub A, you didn't know and you couldn't have known about the problem with the road, right? The state of repair. So if it was completely unexpected, there was a sinkhole that formed in the middle of the night and somebody drove into it before anyone had a chance to deal with it, that's the defense that applies. In this pandemic, I think 44.3b is more applicable. The defense is it took reasonable steps to prevent the default from arising. Well, what's reasonable is informed by what was going on at the time, right? So in a pandemic, what's reasonable is what you're able to do with what you have within reason. Obviously, that's limited, perhaps due to staffing issues. And so you can take comfort in the fact that even if you don't go to C, which is the MMS defense, you still have the defense under 44.3b. So the point that Brian Anderson is going to talk about is record keeping is important during this period of time, making clear and having a log of what your priorities were and why you selected to do some things other than other things is going to be very important for later. So a diary must be kept, records must be kept about the decision making during this critical time if you are not completing your normal levels of service or complying with the MMS because of anything to do with this current pandemic. Let's go to the next slide, please. So the province has made its declaration and some municipalities are following suit. This is an interesting section. So Emergency Management Civil Protection Act Section 4 talks about a declaration of emergency. It says the head of council in 4 sub 1 may declare, Scott, if you could go back. There we go. No, back there. Thank you. So I'll start over. So 4.1 says the head of council of a municipality may declare that an emergency exists in the municipality or in any part thereof, and may take such action and make such orders as he or she considers necessary and are not contrary to law to implement the emergency plan and to protect the property and the health and safety and welfare of the inhabitants. So this is a pretty broadly worded section, and as long as it's not contrary to law, then the head of council can make any orders that he or she considers necessary and take any actions to protect public health and welfare and safety within the emergency area. So it would be, you declare it for the full limit of the municipality, it's the entire municipality. This, if actions are going to be taken to do things like a temporary road closure, and you don't necessarily have time to pass a formal bylaw, then step 1 might be making the emergency declaration and then the head of council making any subsequent orders or directing action to temporarily close certain roads or sidewalks, or maybe lower the speed limit throughout the entire municipality from whatever it is to 40 or 30 kilometers, so people are forced to drive a bit slower. Maybe closing certain sidewalks or pathways or parks, which Brian may talk about. It may speed up a process of reacting, and you don't have to go through as many hoops. Certainly, to me, it makes sense. Let's go to the next slide, please. The County of Simcoe has declared a local state of emergency, and you'll see here, this comes from their website. It was done just 9 days ago, March the 18th, as a result of the pandemic. And as you'll see in the second paragraph, it acknowledges that declaring an emergency affords the county additional powers to protect the health and safety of all individuals and families and businesses. So that's directly talking about Section 4.1 that we looked at. And of course, they point out the fact that their declaration aligns with the government's declaration the day before. Let's go to the next slide, please. The City of Toronto followed suit, and on the 23rd, this is John Tory's declaration. It's a press release, and that's how the declaration gets made. A state of emergency is part of the city's efforts to stop the spread of the virus. So, there's no particular magic from what I can see. That the heads of council simply issue a press release. The communications department distributes it in the normal course as any municipal communication is released to the public. And you've complied with Section 4.1 of the Emergency Management and Civil Protection Act. And after that, then orders and directions and actions are covered under that act, as long as they're made in good faith and in an effort to respond to the emergency. There's a lot less formality and bylaw passing required, which means you don't have to necessarily have full-blown meetings of council and votes and people getting close to one another, et cetera, et cetera. Let's go to the next slide, please. So I'm going to finish this discussion by again reiterating that I'm not advocating that anyone close their roads in a knee-jerk reaction to the situation, but you have some flexibility under the Emergency Management and Civil Protection Act if an emergency is declared to do things. In 16.8 of the MMS, if you decide to close some or partial temporary closures of part of your highways, that's an option. And it's my job as a lawyer to present my clients with options and to discuss those with people who are interested, which I'm doing today. Final comment here is that, at some point there could be litigation arising from this emergency. Section 12 of the Act says where money is expended or costs is incurred by a municipality or the Crown implementing its emergency plan or in connection with an emergency, that municipality or Crown has a right of action against any person who caused the emergency for the recovery of such money or costs. So, query whether there'll be any litigation from Canadian municipalities against China for not disclosing this virus sooner, perhaps others if it's found that the virus spread into Ontario from certain areas in the US before they took affirmative action. There could be some very interesting class action lawsuits and litigation. Obviously, I'm not an international law expert, but I found this provision most interesting because it does create a legal liability for those who caused the emergency. In any event, the takeaway that I want everyone to have today is that the MMS are not mandatory. If you don't meet them because of staffing levels that are reduced due to the pandemic, I don't see any problem in court. A judge will understand. Brian Anderson, who's about to speak, is going to talk to you about taking reasonable steps to set your priorities and having a rational basis to justify it is all you're going to need, I would think, to successfully defend any lawsuits that crop up for accidents that happen during this very difficult time. So thanks everybody for listening. I'm going to stick around to answer some questions towards the end. Scott?
Thanks, Charles. What we're going to do, we're going to switch gears and go over to Brian for his presentation. In the interim, I would remind folks that if they do have questions, there are a number of ways, either through the chat feature on the module or through the questions feature to pose those. I see some people are beginning to post questions there, but this is your opportunity to do so. Brian, I'm going to turn it over to you now to run through your slides. I'll just advance the slides here on my end. There you go.
Thank you, Scott and Charles. Just a few brief comments this afternoon, and before we turn it over to the audience to ask your questions. But I just wanted to let you know that for Frank Cowan Company, it is business as usual. Our offices are closed. There is only a handful of staff that are left in the office, about 5 or 6 people, I believe. Everyone else is working from home. But our business continues. We are still receiving claims. We're still processing those claims. and we're still working on your policies as we have always done. It's a little bit different world for a lot of people, but it is business as usual, and we are there to support our clients, brokers, and partners. Just to let you know as well, if your car, your own personal car or home, is insured with one of our, either our parent company, Intact, or our sister company, Bel Air Direct, they are in the same state. I think they're at 95% of employees at both of those companies are working from home. But again, it is business as usual for both of those companies. Scott, next slide. We've had a lot of questions in the last week and a half with regards to closure of parks and trails, and of course closure of a lot of municipal facilities as well. We've been receiving the sign that's pictured on this slide from a number of municipalities asking for, is this sufficient? And we say yes, it is, and it's being posted in a lot of public places that have been closed and posted at entrances to parks and trails as well. We are typically getting the requests from municipalities about what we should be doing after the municipality has made the decision that they're going to close their parks and their trails. And that's a decision that has to be made locally with input, we hope, from the local health unit. And we are not making any recommendation to our client municipalities one way or another as to whether the trail or park should remain open or should be closed to the public. We are recommending, though, if you do leave it open, that you do lock and close any buildings that might be in the park or along the trail, such as washroom facilities or kiosks or things along those lines should be closed and locked. And if you do have playground equipment, that be fenced off and not available for use by the public. And that way, keeping the open space available for those of you who want to allow some interaction to occur with family. I can see what would happen if I were to live in an apartment, which I don't, but if I were living in an apartment next to a public park and the park was closed, I could see saying, well, I've got to get my children out of the house and let them burn off some of that energy that they have. And I want to go to that open space in that park and play catch with my son or daughter. Yes, we will social distance ourselves from others that might be in the park, but I've got to get my kids out, let them enjoy fresh air, and let me play with my children. If that does occur, you've closed the park, but you do observe people that are in the park, but I believe you're going to have to continue to do those inspections of the park or the trail as you would normally do. You are still under the Occupiers Liability Act for your open spaces, and are required under that act to provide and take such care as reasonable in the circumstances. And you should, if you do know people that are in a closed park, then go in and inspect that park and make sure that there are no defects within that park. That's the best advice that we can give to you at this point in time. Scott, the next slide. Now, Charles talked to the minimum maintenance standards, and there are a number of activities that you do in the maintenance of your roads that do not fall under the minimum maintenance standards, and the municipality should have a level of service in place to deal with those other services that you provide. And the example I put up on this slide is roadside mowing. And I will say that back when the current version of the Municipal Act was drafted some 20 years ago, I don't believe the legislature had any idea that we would use Section 44(1) in this COVID and pandemic. But Section 44(1) says the municipality that has jurisdiction over a highway or bridge shall keep it in a state of repair that is reasonable in the circumstances. And I think using that reasonable in the circumstances is what we need to fall back on during this pandemic. Charles mentioned Section 44.3, the defense that is there under the Municipal Act. And I think we have to take that and try to determine what is reasonable in this circumstance. So I said in this slide that, yeah, if you have a number of staff members who have contracted the virus or are self-isolating at home, and you can't deliver the service in accordance with the MMS or your own level of service, I think the best advice that we can give to you is to continue to provide the service to the best of your ability. First and foremost, I believe you need to patrol your roads. Continue to do that as you would before the virus became a factor. Patrol your roads at the intervals that are set out in the regulation. But then look at what priorities you have, considering the staff and the reduced workforce that you may have in your municipality, and set your priorities accordingly. Triage those priorities. Maybe look, as Charles was mentioning, look at the roads that are priority roads in your municipality, and determine what you can do on those priority roads, those high traffic volume, high speed roads in your municipality. One thing that came out of this morning's session too that I'd like to pass along is that, and I've noticed in our neighborhood where I live, far more people out walking than is usual at this time of year. And a number of people are getting their bicycles out of storage, and we see families riding their bicycles on the streets. And that's a good thing. But if you do have bike lanes or bike routes within your municipality, maybe those should be a little bit higher priority, because as I said with the parks example, yes, I want to get out and play catch with my son or daughter. Well, maybe we want to take the family for a bicycle ride. And so maybe during this pandemic time, we pay a little bit extra attention to those bike lanes and bicycle routes, considering that there might be more than usual number of people who might be on those lanes and routes. But again, I think the important takeaway here is to act in good faith. And I think that is there. We have to recognize that, yes, we have a reduced workforce available. Yes, we do have a number of things we need to do in our municipality to provide an adequate level of service, but that level of service has been reduced because of the pandemic. So again, triaging them, doing our best, and getting and acting in good faith. The one thing that we could also consider, if you are in a two-tiered municipal environment, upper tier, lower tier, you might want to look at applying the same restrictions or level of service across the entire area, so that people that travel through your community to go to the city or go to other parts of the municipality or into your neighboring municipality would see the same level of service. So let's use my example for roadside mowing. Well, let's say you decide in your municipality that roadside mowing isn't really a priority, and hopefully by the time this pandemic is over, we won't have to worry about it. We'll be able to tackle our normal maintenance activities. But let's say we decide that we're not going to do that for a while, except maybe at intersections where we have maybe reduced sight triangles because of long grass. But let's maybe look at, can we apply that across the whole county or region or area, rather than just one municipality saying, well, yeah, we're going to cut out roadside mowing for now. Another municipality say we're going to cut back on this. Let's try and see if we can create the one standard of care that might apply across all jurisdictions within the county or regional area. And that way you would have something that's consistent for people that they become accustomed to as they drive through the areas, and be able to accommodate as they drive along. Scott, the next slide, please. One of the things that I've done since I've been with Frank Cowan, and even with when I was at my time at Ontario Good Roads, was document. We can't say that enough for risk management purposes. So as always, you document what the work you've completed. But I was also include now in that documentation, either in a daily log that's kept by a supervisor or the manager, that you document what you've changed because of the pandemic and because of the reduced workforce. So what priorities have I set that are different now than what we would usually have accomplished? How have I triaged those different priorities and come up with a work plan that you're able to achieve with a reduced workforce? And then make sure that in that documentation that you identify the number of staff members that are away from work because of the virus, either self-isolating or heaven forbid they've contracted the virus. And you might have to do that for that day, that week, or that month because of the virus. Scott, the next slide. I just want to wrap up with a couple of things, and one thing that I see as important, and I haven't seen this as much in all of the news and briefings that have been held by different organizations and different medical officers of health, is that, wash your hands is critical. Use a tissue or cough into your elbow if you do have to cough. But I haven't seen a lot of people or a lot of come out and saying avoid touching your face. And I think that is critical. If you are out in public and touch a surface, don't touch your face until you've had a chance to wash your hands. That includes if you're wearing gloves as well. And it's hard. I had to go to the grocery store the other day, and I walked around with my hands in my coat pockets because I was realizing I was going to the face to either scratch my nose or whatever, scratch your face. And you're subconsciously doing that, and it's hard to stop. So I was walking around with my hands in my pocket. It may look a little silly, but that's why I was doing it. So again, add that to that list of things that you should be doing. Scott, the next slide. And again, I think we're all doing very well and getting accustomed to the social distancing. I see it happening here in my own neighborhood. We are staying a little bit further apart, and when we greet other people as we walk down the sidewalks, we're kind of walking off of the sidewalk into the boulevard area and keeping that space between us. So we're getting the message, and that's good to see. Scott, the last slide. And I'd just like to say, hopefully everyone stays healthy through this pandemic, and we all get through this very well. But there are a lot of people out there that are very stressed about this pandemic. And I'd just like to say, if you are feeling stressed, take time to be with your family. Social distance from your friends, which is hard to do, but by all means, be happy. Thank you.
Thank you, Brian. We have 15 minutes left for questions. A number have been posed already. I'm just going to push them out there, and we'll try to get through as many of these as we can, as quickly as we can. Mike Molinari from East Williamsbury is asking if it is possible for a municipality who has already declared a state of emergency to pass a bylaw placing all of its roads in a state of repair. What would you say to this sort of initiative?
Well, Scott, it's Charles, and obviously this one falls straight into my lap. Hello to the town of East Bloomsbury folks on the line, one of my very good clients. I would say that unfortunately, the power to pass a bylaw that deems your roads in a state of repair, unfortunately, that's not a power that exists. The Municipal Act 2001, Section 44(1), is provincial legislation that cannot be overridden pursuant to any municipal bylaw. An example of this was an effort to sue private homeowners who failed to comply with a municipal bylaw to clear the sidewalk in front of their house during the winter. And a municipality sued the private homeowner, saying when they got sued by a plaintiff who slipped and fell on the municipal sidewalk, and the courts have emphatically said a bylaw doesn't trump 44(1). The municipality is liable if it fails to maintain its roadways. It can pass a bylaw and enforce it against a private property owner, but it doesn't change the legal duty of care, which is primary and owed pursuant to the statutory duty. So, my suggestion is, short of that blanket declaration, any municipality that's out there has to consider alternatives. Once a state of emergency is declared, 4.1 of the Emergency Management Civil Protection Act talks about the unfettered right to make any orders. So you can close the roads, and that's what I've been talking about. If you close the roads or temporary closures of part of the roads, for anything covered under the MMS, 16.8 applies, in my legal opinion, in this pandemic, but that's very limited. And obviously I'm not advocating full road closures. So if you're going to keep the roads open, you've still got to maintain them, and you're in a situation of prioritization, and obviously clearly lower levels of service than you'd ordinarily achieve. And it's going to come down to just triage, as Brian said. Brian, do you have anything to add?
No, I don't, Charles. I like say that I've never heard of anybody trying to declare the entire road in a state of repair, and I agree with everything you said there.
Yeah,
okay.
I wish it was possible. It would make sense to a certain extent. I think what, in order to achieve what was just suggested, is the province of Ontario, Doug Ford and his government, as part of their declaration, would have to make an order suspending 44.1. In other words, a blanket order that says, the duty to maintain is hereby lifted or altered in some way. And there, as a lawyer, I'm sure you could craft language that lowers the standard of care from one of reasonableness down to something much lower. But short of a provincial order, there's no way to affect that magical result. If there was, certainly this would have been a much shorter webinar, sadly.
So building on the idea of liability, Nasir Mahmoud in York Region has asked if municipal employees are personally liable if the public doesn't adhere to advice and actions taken by the municipality and something happens, they become infected or become injured as a result.
So I can answer this. Under the Municipal Act, Section 448, every municipal employee is protected from personal liability for doing their job. So any and all of you who are municipal employees who are listening, if you're doing your job, you can't be sued for anything you do, except for one thing. Anything you do that's in bad faith or outside the scope of your job. And I'll give you an example. If you're a plow operator and you get out of your truck and punch somebody in the face, that's not something you're going to be immunized for, because that's not part of your job, right? But if you're driving your plow truck and you hit somebody, maybe even run them over and kill them by accident, that's covered by your insurance, and you're also personally not liable. The city is liable as your employer through what's called vicarious liability, and it's the city's insurance policy that will pay out. You might get fired if you were a bad employee, but that's not personal liability from a legal standpoint. So that's a very important thing to remember. Under the Emergency Management and Civil Protection Act, there's a similar provision. When a head of council makes an order under an emergency declaration, the council, the councilors, and the municipal employees are all immunized personally from liability for taking action pursuant to those orders. Now, The municipality can be held liable for negligence if somebody in implementing one of those orders does something that's negligent, right? But it's the municipality, the city, the corporation that is again vicariously liable for any negligence in implementing the Emergency Management Civil Protection Act order. So another reason to declare the order and shelter underneath it in terms of actions taken, there's a very nice immunity clause there too that largely mirrors the Municipal Act section 448 with one significant exception. It appears to apply to the head of council. So the councilors who are not technically municipal employees also are immunized.
Okay, a couple of questions here for you, Brian. Is Frank Cowan recommending closing playground equipment within parks?
We're not recommending it, no. It's again, with the input from your local public health unit, but it's probably good advice for you to fence off your playground equipment in the park, and that's the local decision what to do, because we are hearing evidence how long the virus will last on surfaces. And again, if an infected person is on the playground equipment and you go on to the playground equipment shortly thereafter, you could contract the virus. So again, we're not advising them one way or another. We're telling them that it is up to the municipality and the public health unit, but it's probably a good idea for them to fence it off, but again, do that with consultation with your public health unit.
Okay, so you just answered the question that was simultaneously posed by both Louise Raybosch in Innisfil and Jesse Pace in Deep River about fencing off playgrounds. There's another question here about unilateral changes made to the workday. Presumably under a municipality under an emergency declaration has decided to move to 10-hour days rather than the usual 8-hour full-time days. What right does the municipality have to do that? And does the fact that an employee may refuse that request, how are those dynamics influenced by the dynamics of the declaration in the pandemic?
Well, I'll chime in. The Section 4.1 of the Emergency Management Civil Protection Act says that any order or act taken, as long as it complies with the law, is allowed. So the Employment Standards Act is the law, and one can also look to potentially, if you have a collective agreement, your contract in the language within a collective bargaining agreement with a particular group of employees, there may be a provision for a certain type of emergency, there may not. But in terms of the law and the Employment Standards Act, you have to comply with it. Put it this way, you can try and force people to work, but if they don't want to work, they're probably not gonna. And in this extraordinary situation, I think discretion is key. Being very sensitive and understanding to your employees' needs is key. And talking to your human resource experts, if you're lucky enough to have a human resources expert working for your municipality about this question is important. And you may need to get a legal opinion from an employment lawyer, which I'm not. So I'm not going to sit here and talk about employment law beyond what very limited knowledge I have, because it's not my area of expertise. But I'm smart enough to know as a lawyer that when you get into an issue about employee rights and hours of work and applicable legislation, in a crisis like this, you got to try and work together with them. And as I said on an earlier webinar, you may, come up with a way that if council will order that double overtime gets paid instead of regular overtime, or you come up with some enhanced compensation for those extra hours for staff, that may be an incentive for people to take a little bit more risk as part of their work. The other thing I know about employment law is that an employer has a duty to take such reasonable steps for the health and safety of their workers. if a worker comes forward and expresses a concern about their health, you have to investigate as an employer and take whatever steps you can that are reasonable to try and make that employee as safe as possible while they're executing their job duties. And that may be providing a mask or gloves if those are available. They seem to be limited supply. But separating workers, as Brian has talked about earlier, so I'm giving Mr. Anderson kudos. He talked about having one employee in a vehicle instead of two working together on a crew, staging work so that individuals can separate themselves physically, all very wise precautions. So that's all I can really say about that issue.
Okay, just a point of clarification about the previous issue. One of the questions, this is the downside of trying to do many things at once here. One of the questions was actually seeking clarification, Brian, or if Frank Cowan would have a recommendation about when a park is closed, is there a benefit to fencing it off, or is it sufficient just to have the signage indicating that the park had been closed?
Well, the fencing it off physically is going to ensure that no one is using the park. The signage, yes, you can put it up and identify that this park is closed, but again, people may ignore it, as per the example I gave in my presentation, because they need their kids to burn off some energy, and letting them run around in the park or play catch with them in the park is that. So if you definitely want people to stay out of it, if, like say, if the entrance to the park is a significant pinch point, and they can't do the proper social distancing, or they're not getting the idea that of social distancing, then yes, to close it and make sure no one uses it, you're going to have to fence it off.
Okay. This is a question that comes out of actions taken by New York City, and we're also understanding that other areas, urban areas, are looking at it. And this is closing roadways to allow pedestrians to have significant social distance between other roadway users. So they're undertaking the closure of roads for to traffic, vehicular traffic. How would you advise a municipality to go about enacting an initiative like that?
Well, I would tell the municipality they have to physically close that road. If they're going to change what's the use of that road from being used by motor vehicles to being used by pedestrians, they're going to have to physically close off that road, post signs, road closed, put up barricades, and physically close that road. They would need to put that up on their website and send that notice out through social media, possibly on the local news or TV if available. But the other part that you would definitely need to do is notify the police, the fire, and ambulance services so that they are aware that that street is physically closed and that the use of that road has been changed from a road by motor vehicles to a road used by pedestrians only, so that if there is an emergency response that has to be made, they can make the detour rather than arriving at that site and saying, well, now we have to make a detour around it and delay their emergency response. Scott?
Okay, that's a fairly comprehensive answer. That we're, the clock's working against us here, but we do have two questions, so I'm going to try to get them both in. The next one's for you, Charles. It comes from John McLennan at the City of Hamilton. He asks, in terms of limiting liability exposure, is there a value in declaring a municipal emergency? On the other side, is there a downside to declaring a municipal emergency?
Yeah, so simple answer, it's 100% upside and 0 downside in my legal opinion. When the head of council declares a local municipal state of emergency, Section 4.1 of the Act gives them broad authority to make orders and take action to enforce your local emergency plan, as well as protect public health and safety. There's the protection from liability that's mentioned in the Act for members of council and staff who carry out those orders. There seems to be no requirement for formal bylaws to be passed, which saves time and drafting and paperwork. And I don't see any negative downside to it. It can only work in lockstep in conjunction with all the other things you're going to be doing anyway. So if I were the mayor of London or the mayor of Hamilton, I'd follow suit like the city of Toronto and County of Simcoe, and I think Burlington and a few others. Make the declaration, do it in a way that doesn't cause public panic. Make it clear that if you read the press release, it's being done simply to enhance the ability of the local government to respond to the developing situation. And I think there's all kinds of benefit and no downside.
Okay, and then our final question, I guess I'd pose it to both of you because you may have something to say with regards to this, comes from Taylor Crinklaw at the City of Woodstock. The question is, would you explain further how the Emergency Management and Civil Protection Act could be used to reduce the risk of liability to the city?
Sure. Well, obviously that could be another half-hour discussion, but in a nutshell, if you read the act, it's available online. There's a section that talks about the limiting of liability and the immunity of municipal members of council and staff from personal liability for any good faith steps taken under the act, both in declaring the emergency and then fulfilling any orders or actions determined by the head of council that are necessary. So right there, in addition to the Municipal Act immunity, you've got a second immunity that's provided for by statute. Obviously, you've got an emergency management plan. If you declare an emergency, you may have to activate your emergency response center. So, there may be a financial cost. I don't want to make it seem like it's just as simple as waving a magic wand. But certainly, if in my mind, we're in the middle of, the biggest public health crisis in our lifetimes, and maybe in anyone's lifetime for the next 100 years. So a decision to declare a state of emergency and activate your emergency response center if you have one, and start taking the steps, if any, that you'd feel are necessary under your response plan. If you have a plan, as some do, for dealing with a pandemic, I can't imagine that's a bad idea in any sense of the word. But these are just my thoughts as a lawyer. There may be political and financial considerations that limit that decision. It's not an easy one, but I see it as a positive step for sure.
Okay, with that, that'll be our final word today from our panelists. I want to thank the 101 people who sat in on our session this afternoon. This was, as I said at the outset, the fourth of four that we've run looking at this issue. I appreciate your time during a trying period for all of us. I also especially want to thank Charles Painter from Patterson McDougall LLP and Brian Anderson from Frank Cowan Company for being generous with their time and their expertise. It was a great service, I think, to everyone who attended one of these sessions to be able to learn from people who've had years of experience and loads of expertise that they're ready to share. For those still listening, OGRA is looking at a series of other learning opportunities similar to this, so please stay tuned. If there are concerns relative to the COVID virus pandemic that is affecting your municipality, please reach out to us if you feel we can be of assistance. I can be reached at Scott, SCOTT, at ogra.org. Again, that's Scott, SCOTT, at ogra.org. And we'd be happy to help. Thank you very much, and I wish everybody 6 feet of personal space and good health. Talk soon.
Thanks, Scott.